has seen 25% of the time for its emergency room closed just this year alone. It is an hour and a half to the nearest facilities. Will the Premier please explain why that is acceptable health care for rural BC?
Nicola Valley Hospital in my riding, the ER has been closed for over 26 days in this past year. To the Premier, when will hospital closures stop in British Columbia?
The emergency room in Karameas has been closed evenings and weekends for 1,213 days. Why does this Premier think that this is acceptable?
Mr. Speaker, Lillooet Hospital has had its emergency department closed for 26 days. Does this Premier think it's reasonable for the good people of Lillooet to drive over 2 hours on snow-covered highways to reach Royal Inland Hospital in Kamloops? Why does this Premier expect people to risk their lives to access basic emergency care?
Thank you, Mr. Speaker. Cariboo Memorial Hospital has had 18 days of emergency closures over the past year. Mr. Speaker, can the Premier explain how many hours of travel are acceptable when an emergency room closes in rural British Columbia?
Mr. Speaker, the Mackenzie Hospital has been closed 13 times so far in 2025, and it's only the end of February. A simple question to the Premier: does he believe that Northerners deserve quality health care?
Mr. Speaker, 100 Mile House District had its ER closed for 10 days. Royal Inland Hospital is 2 hours, over 200-kilometer drive. Mr. Speaker, why is the Premier forcing people to drive for hours for emergency care?
Clearwater's Dr. Helmkin Memorial Hospital is an hour and a half away from Royal Inland Hospital. This Premier forced those needing emergency care to drive that distance on 9 separate days this year. Why does this Premier put people's lives at risk?
Mr. Speaker, Mission Hospital ER was closed on 7 different occasions. Why does the Premier think that their emergencies are not important enough to have a local ER open?
Fort St. James had its ER shut down for 6 days by this Premier. The ER at UNBC Hospital is 160 kilometers away. Why is this Premier forcing them to take a 2-hour ambulance ride to an open ER?
Mr. Speaker, the Slocan Community Health Centre ER is over 2 hours from Queen Victoria Hospital and 4 hours from Kelowna General. Its ER was closed for 5 days. Why does this Premier expect people to drive through dangerous mountain passes to get emergency care?
Arrow Lakes Hospital ER was closed for 5 days. Why did this Premier force those in Arrow Lakes to drive for hours to get emergency care on 5 different occasions?
Thank you. 800 hours Kitimat's ER was closed last year, and that's just between January and September. Why does this Premier think it's okay to force my constituents to drive hours on snow-covered highways to access an ER?
Mr. Speaker, BC's North needs proper ER access. Masset on Haida Gwaii deserves proper ER access. Chetwynd, Tumbler Ridge, and Dawson Creek deserve proper ER access. Why did this Premier close their ER doors?
Delta residents had their ER closed for 2 days last weekend, and possibly this weekend as well. They are being asked to go to Surrey, where wait times are as high as 18 hours. Are Delta residents supposed to accept that ER closures are the new normal?
The South Okanagan General Hospital emergency room saw 40 days of closures this year. To the Premier, how many ER closures are enough before this government takes action?
Elkford's ER department in my riding has been closed for over 2 years. 2 years. Why did the Premier do nothing to prevent Elkford's ER from closing?
The hospital in Creston Valley has also closed, and is vital for the community. So again, why does the Premier continue to close ER services for those in crisis?